So just to put this into a bit of global context, viral hepatitis, it has been called a pandemic. It's also been called the silent killer. It kills many people around the world, as you can see from this simple graph, which is a few years old now. So I'm not sure if that figure needs a slight adjustment, but it wouldn't be far off. But as you can see, viral hepatitis is responsible for the deaths of more people than malaria, more people than HIV, and it's quite extraordinary to me that it's taken so long to get the attention that it's now getting. But it's a very important issue affecting a lot of people around the world. And it is World Hepatitis Day, so a very fortuitous time for us to be holding this event. This is one of 9, I think, World Health Organization acknowledged health days around the world. The date was selected, it's actually in honor of the Nobel Prize winning Dr. Bloomberg, who has passed away now, but this would have been his birthday. And he was the person who identified the hepatitis B virus back in the 60s and later went on to develop the testing and the vaccine for hepatitis B. So it's quite a meaningful date. So here's just a little 30-second video that they've put out to commemorate today around the world.
In the time it takes to watch this 30-second video, someone will lose their life to hepatitis. It could be your parent, your partner, your child. It could be you. But it doesn't have to be this way. There is a cure for hepatitis C, a vaccine and effective treatment for hepatitis B. 9 out of 10 people with hepatitis don't know they have it. Don't wait. Get tested. It could save your life. Hepatitis can't wait.
So that's this year's theme, hepatitis can't wait, and the idea being that even in the context of a different global pandemic with COVID, this issue really still is very important, and we still need to keep our eyes on it and be continuing to work towards eliminating hepatitis, viral hepatitis. So hopefully you can see my slides okay. But there's an estimated 340,000 people living in Australia with hepatitis B or hepatitis C, and those figures relate to chronic hepatitis B or C. So, and there has been a marked decrease in the amount of testing that's been happening. So that's something that all healthcare has really been impacted by the COVID pandemic. It's not a huge surprise, but it's not only that, it's also, I think that there was such a huge push when the new medications came out for hepatitis C. It got renewed energy behind it, and people are kind of losing a bit of steam with keeping up the pressure on viral hepatitis. So we really don't want that to stop. So I know there's quite a few clinical people with us today. There's also people without a clinical background, so some of the information is going to be quite broad. So just as a setting the scene statement, HEPA literally means liver, and itis means inflammation. So all hepatitis is inflammation of the liver. So that can be caused from alcohol consumption, from fatty liver disease, which is possibly changing its name to metabolic to MAFLD. Some chemicals and drugs and medications can cause a hepatitis, autoimmune disease, and viral infections. So the viral infections of hepatitis are the A, B, C, D, and E strains, but we will be focusing on B and C as they're the main health concerns that we have here. So the liver is the hardest working organ that we have. It filters the blood. It's also our largest internal organ. It produces bile, cholesterol, protein, and blood clotting agents, regulates our hormones, carbohydrates to glucose, vitamins and minerals. So if our liver isn't working well, and we really on the side here, you can see fatty liver disease. So you can get that from alcohol-related liver disease, non-alcoholic fatty liver disease. Also seem to reduce the incidence of HCC and liver-related mortality in all liver conditions, especially for Asian people. Aspirin, there needs to be more study on that, but there has been shown to be a link in reducing the likelihood of progressing to liver cancer as well.